Anniversary of the Center for Bioethics and Medical Humanities at Universitas Gadjah Mada. I am very sorry I will not be able to join you live during the webinar. I'm proud to have been working with the faculty at the center since 2007. I was lead faculty at the University of Washington, where I hold a faculty position, on an NIH-funded education program for Indonesians. They came to the University of Washington to learn bioethics, policy, and law. I also have had the opportunity to live in Yogyakarta when I was a senior Fulbright scholar in 2011 to 2012 for 6 months. I have had numerous opportunities to teach at Universitas Gadjah Mada, especially in pediatrics, since I'm a pediatrician, and also, of course, at the center. We've collaborated on a number of international projects and have worked in Yemen and also in Pakistan together. Our work in Pakistan was, of course, with the Center of Biomedical Ethics and Culture, and with Professor Amir Jafri, who you will be hearing from as well today. I've been asked to give a talk on women, bioethics, and COVID-19 in America. I have to recognize Canada, of course, which is part of North America, and actually sits in stark contrast to the United States in its response to COVID-19 and the control of the epidemic in that country. I'll now turn to the PowerPoint slides I've prepared today. We cannot consider COVID-19 in the United States without understanding the multiple crises that are ongoing currently. In addition to the COVID-19 pandemic, which is causing a severe economic crisis, we have a racial justice movement, or Black Lives Matter movement in the United States, with demonstrations, many legal protests that are nonviolent, and some violent eruptions in cities across the country. This is causing a lot of distress in the United States. It's also causing a movement that calls for police reform, which is a huge issue right now. Additionally, we have climate change fires and storms. Right now in Washington State, we are enveloped with smoke. As a matter of fact, I can't go outside without an N95 mask or some other kind of short-term protection because the governor has declared an emergency, and we are number one with hazardous smoke and air quality, poor air quality in the world, often competing with Oregon's Portland, the city of Portland, and other cities on the West Coast. And right now it's very severe. There are also multiple intense hurricanes originating in the Atlantic Ocean and Caribbean. I would be remiss if I didn't mention the other crisis in America, the crisis of democracy and the rule of law and the Constitution being under attack by our own government. All of these issues relate to COVID-19 and the control of COVID, and of course, that includes the risk of disease and death for women. I won't have that much time today to go into all the details, but you can imagine if you are in an environment where there is an irritant in the air, such as with severe smoke from the wildfires all throughout the West Coast, you are at increased risk of more severe respiratory illness and consequences from that, including hospitalization. So additionally, as you can see, I'm even having some respiratory reaction to the smoke that's also in my house. When someone is having some irritant, whether or not you have a respiratory risk of reactive airways, for instance, there's more of a chance of coughing. If you have COVID, there's increased transmission. And so many of these crises are making COVID worse in the United States. We see a pictorial of what is going on in the United States in terms of the fires. More acreage has been lost in this fire along the west coast of the United States, involving California, Oregon, and Washington than ever before. And unfortunately, it is what will continue to happen if we don't do something about climate change. And we see people who have lost their homes. It's tragic, and many people have already died. We see Seattle in the right upper corner, and this is what my city looks like. Hopefully, this will dissipate soon. Many of you already know that the United States is #1 for cumulative cases of COVID-19. We're over 6 million. It's almost 6.5 million. And over 190,000 deaths from COVID. It's tragic, and we are not very happy that we are #1 in this regard. And why is that? There's a new Woodward book out that you may have heard about. In this book, Bob Woodward, who has reported on 19 presidents and 19 books, has interviewed for many hours, 18 interviews. He has written a book where he exposes Trump for who he is. Trump and the recordings of his conversations with Trump document that Trump knew early on, as a matter of fact, in January of this year, he knew coronavirus was deadly and worse than the flu, while intentionally misleading Americans. He says he still wants to play down COVID. There isn't much rationale for this other than his thinking about politics. He seems not to care that people are dying. And so it's a very tragic situation in the United States. It also is tragic that in 2018, the Trump administration disbanded the existence of a National Security Council pandemic unit. This undermined the ability to prepare for and implement a response to COVID in the United States. Currently, and throughout the year, we have seen Trump promote no social distancing and no masks. And this is a picture very recently on September 12th that CNN put up online of a rally that he is doing around the country. He has these political rallies, and he mocks people, Trump that is, mocks people who are wearing masks. And it's really very concerning for anyone who wants to control the disease. And women, are they better at leading through the COVID pandemic? Are women leaders really doing a better job on coronavirus? Well, this study says yes. Supriya Garikipati and Uma Kambampati in the conversation, and the citation is below, show through their research that women leaders are doing a much better job. You see women leaders in blue in both of the charts. The one on the left is COVID-19 cases per million population through May 19th, and the one on the right is deaths per million population through May 19th. And we see the blue women-led countries, which are matched using GDP, population density, and population over 65. And they're matched to countries that are similar to them. These women-led countries are doing much better in terms of cases and deaths. And they are doing much better whether they are considered near the most comparable nation or the nearest 2, 3, or even 5. And that's in support of women-led countries, although Belgium is an outlier. Belgium is led by a woman, but despite that, they have performed badly on cases and deaths. UN Women has a very nice chart showing the disproportionate impact in every sphere of life, in every way, in terms of COVID-19. So women and girls are disproportionately impacted because of the following issues: violence, violence against women in general, and domestic violence in particular. They are more likely to be healthcare workers in the healthcare sector at large, and they're more exposed and then have more risk of getting COVID and dying from COVID. Women's health has been impacted. There have been economic shocks that are staggering around the world and in the United States. Women are paid less than men, have less savings, and therefore the impact is more severe. They're not paid for much of the work they do. This includes young women and girls, and of course, migrants and women and girls in conflict have particular issues with COVID exposure and risk of illness and death. Women are more likely to work in jobs considered essential, putting them at increased risk of COVID-19 exposure and disease. 1 in 3 jobs in the United States held by women has been designated as essential. According to a New York Times analysis, which is with the federal government's essential worker guidelines and this census data analysis, they found that the following essential workers are predominantly women. That's over 50%. Social workers, healthcare, critical retail, and then there are lower but significant percentages of women in many other work areas. Overall, all essential workers, the share of that for women is 52%. So 52% of all essential workers, in other words, are women. And what we're seeing in this country is true globally. The data may be slightly different, but this is true around the world. Work is often underpaid and undervalued, and that is certainly true everywhere. Violence against women and girls increases significantly during stay-at-home orders. The measures that were implemented in countries, in this country, my country, the United States, for SARS-CoV-2 have been adopted. Quarantines, social isolation, travel restrictions, and stay-at-home orders. All of these have been adopted worldwide as well in many countries. According to the CDC, 1 in 4 women normally on a regular year without COVID experience intimate partner violence. And so this has increased because of the restrictions implemented to control SARS-CoV-2 or COVID-19. Early evidence has shown that there has been significant increase in violence against women and girls, up to 27% in the early weeks of the stay-at-home orders in the United States. Some states had less of an increase, some had more. This is consistent, again, with the global pandemic, although some of the data from other countries are exponentially larger than 27%. I've seen some data of an increase of 60% in 1 or 2 countries. The U.S. states, some of the U.S. states are using COVID-19 as a way to limit access to reproductive health services for women and girls. And it's really discriminatory, and it's very oppressive for the women who need these services during COVID. And this was reported to the United Nations, and there was a discussion about this in committee, and there have been reports about the abusive nature of these restrictions during COVID in the United States. I am leading an effort through the NGO Uplift International to have a webinar on some of these issues related to women and reproductive health and COVID and racism in the United States. I will send information for you to the Center for Bioethics and Medical Humanities. If you are interested, they can provide that information and the link to register to our October 13th webinar. So I have some questions listed here that we might consider about the ethics of the situation for women in the United States and all people in the United States in general during COVID and during the Trump era. Who is responsible for the disproportionate impact on women and girls during COVID? What are the responsibilities of governments at the national and local levels to act specifically to mitigate this disproportionate impact? What policies and laws must be developed and implemented? What are the what are the responsibilities of civil society actors? What are the responsibilities of universities, of centers of bioethics? What are the responsibilities of individuals and communities? And what are the responsibilities of countries that are wealthy to low and middle income countries? What are the responsibilities of regional countries to each other? How do we hold institutions, governments, businesses, and other actors accountable? Well, I think in the United States, the US response is showing me a glimmer of hope. It's showing many of us a glimmer of hope. Activism is alive and well. When you see something that is wrong in society, you do something. You speak out, you publish data, and many are. You write opinion pieces, and many are. You use social media or any other kind of communications to increase knowledge and awareness of what is going on, and to ultimately change policy. We need to demand policy change. So there is less risk and more control of COVID-19, which appears to be a disease that will be with us for a while, even after there is an effective and safe vaccine. Vote for leaders that will promote fair policies and create new laws that respect, protect, and fulfill the rights of women and other vulnerable groups in society. And we must consider teaching, educating everyone about ethics and justice, about the real, the way to go forward in terms of non-discrimination. And doing this in schools, religious institutions, home, and the workplace. And I thank you all for your attention, and I hope you have a wonderful rest of the webinar. Congratulations on the anniversary, Center for Bioethics and Medical Humanities. Bye.